Hello, everyone. We'll be getting started in 5 to 6 minutes. Just want to give everyone an opportunity to get logged in, and we'll get started momentarily. Hello, everyone. It's 1 o'clock Eastern, 10 o'clock Pacific, and we're going to just leave an additional minute or so for the last couple of people to get logged on. So hang tight, and we'll get started momentarily. All right, good morning, everyone, or good afternoon if you're on the East Coast, and thank you for joining the RDLA June legislative webinar. We have a pretty packed agenda today, so we'll try and move through it quickly, but leave time for questions and answer sessions. Today, I will give a short overview of the regional legislative conferences and district lobby days that are upcoming. The legislative conferences are next week, and the lobby days will be taking place through July and August. and then Jawanda Mast with the National Down Syndrome Society will be discussing the DS Works and Able to Work programs. Patricia Egan with the National Lymphedema Network will give an update on the Lymphedema Treatment Act. Then I will give a short update on SB 1095, that's the Every Life Foundation's newborn screening initiative in California. And finally, we will have a Capitol Hill update. Unfortunately, Max Bronstein with the foundation is a little under the weather, so our lobbyist Harry will be giving the update on it. So without further ado, the regional legislative conferences will be taking place next week, and they are an opportunity to prepare patients, caregivers, academics, physicians, and other individuals in the rare community to prepare them for meetings with their representatives and senators during the summer congressional recess. This is a great opportunity for you to network with other local rare advocates. There's no charge to attend, and lunch will be provided at all three of the conferences. Registration is required, and it's available through June 22nd. So we urge you to register today. The website to register is shown at the bottom of the page of the slide at rareadvocates.org/legislative conferences. The three locations for the conferences are in Seattle on June 30th, in Chicago also on June 30th, you definitely heard that right, and in Boston on June 28th. The goals of the in-district lobby days are to help train advocates to advance rare disease legislation, such as the 21st Century Cures Act, to strengthen relationships with your members of Congress. You should definitely view the meetings as opportunities to build or sustain a meaningful relationship, and to build on the meetings from Lobby Day during Rare Disease Week earlier this year. This will also allow advocates who can't travel to D.C. to have an opportunity to meet with their federal elected officials in their local offices, which can often be much more casual and an opportunity for the legislator to spend more meaningful time with you since they're not being rushed off to committee meetings and other surprises. And we noted that a best practice of effective advocacy is to make your friends before you need them. We need allies who can champion rare disease causes. So to give you an overview of how in-district lobby days work, the meetings will take place between July 18th and September 5th in your legislators' district offices. We're working with advocacy associates who we've worked with in the past to schedule meetings and contact advocates with your schedule. RDLA will provide background information on key legislative issues such as the 21st Century Cures Act, NIH and FDA funding, et cetera, that can give you some background, and more information, including tips on how to have successful meetings and what to research prior to your meetings, will be provided in a webinar on July 13th at 2 p.m. Eastern, 11 a.m. Pacific. In order to attend the webinar, we will be sending details to registrants and other individuals, so we urge you to register at rareadvocates.org/in-district lobby days today. So with that, I will pass it on to Jawanda, who will give an update on DS Works. Jawanda, are you there? Hello, Jawanda?
I'm here. Can you hear me?
Yes.
Okay. I want to thank you for inviting us to be a part of this. We love working and partnering with many other organizations, and your organization is one of those. And most recently, we've also been doing a social media blitz on the 21st Century Cures campaign, and we appreciate the opportunity to partner with other organizations to accomplish our mutual goals for individuals. My name is Jawanda Mast, and I am the manager of grassroots advocacy for the National Down Syndrome Society. I work with our ambassador network across the country and our state-level advocacy coalitions, and I do many other things, but that's the main projects I work on. I am located in the Kansas area. I live in a suburb of Kansas City, and I have a 17-year-old daughter who has Down syndrome. So that's my connection to this community, and I'm very pleased to be with you all today. We at NDSS, the National Down Syndrome Society, recently rolled out an employment campaign. It coincided with World Down Syndrome Day on March 21st. We've passed the ABLE Act. Individuals with Down syndrome and other disabilities are included in schools and going to college, and we want everyone to be able to have meaningful employment. So we have launched what we call #DSWorks. It's pretty simple, and it tells on the slides that you should have in front of you about it. Our goals are to educate the general public about how individuals with Down syndrome are able to work and should be a part of the workforce. We want to encourage corporations and businesses to invest in hiring people with Down syndrome. And we want to increase the opportunities for individuals with Down syndrome to work in meaningful and competitive employment settings. I think that this goes along with what most people want for their children and what we all want for ourselves in life. The key components of the DSWorks program are we want to create and compile comprehensive resources for employers and individuals, families, and local DS organizations. What we've learned is things are pretty splintered out there, and we're trying to have a more cohesive approach where individuals, corporations, businesses, even schools would be able to come to our website and find information. I'm going to be talking about the Able to Work legislation, and that's part of our advancing federal and state legislative agendas. Because we are going to need to do that to break down barriers to meaningful employment for individuals with Down syndrome. There's lots of those, and of course, ABLE Act is one thing that has happened that's going to help individuals with Down syndrome and employment, but there's a lot more that needs to be done. The last key component of the DSWorks campaign is NDSS Corporate Roundtable. We're going to be working with local and national organizations and businesses who want to join forces to employ and hire individuals with Down syndrome, and we are hopeful that we will bring to the table CEOs of companies and some of the large and small companies across our country that may be interested in employing individuals with Down syndrome. And the picture on this slide is Blake Kyron, who is in Sanger, Texas. And Blake has Down syndrome, and he's the youngest business owner in Sanger, Texas. He has Blake's Snow Shack, and you may have seen it on social media, but he just opened a second location, so we're pretty proud of him. Next slide, please. One of the things that we have already developed is something called Valued, Able, and Ready to Work, Employing Individuals with Down Syndrome. And it's an NDSS Down Syndrome Employment Guide. And David Egan, one of our self-advocates who has held the job for a very long time, was also a Kennedy Fellow and worked on the Hill, was instrumental and a big part of putting that together with Vanessa Quick from our organization. And that is available online. You can go to our website and you'll find the DSWorks tag at the top of the NDSS.org website, and you can find that guide and download it there. We want to help facilitate connections between employers and affiliate groups through local employment initiatives and job support. We want to help with materials for job preparations, interviews, resumes, materials for families who are just getting started, transition resources. With my daughter being the age she is, I'm deep in this process, and I've discovered some spots where you can actually find goals for IEPs that have already been written to help with job readiness, but also for readiness to go to post-secondary education programs. and we would like to put together a directory of companies who are willing to hire individuals with Down syndrome and compile a list of small businesses owned by individuals with Down syndrome. We know all these things exist, but we're trying to put it all together in more of a one-stop shop. Next slide, please. How can DS work to help you, or how can others help? And one of the ways that we hope some of you may be able to help us is we are circulating an employment survey for individuals with Down syndrome. There have been very few employment surveys done for individuals with Down syndrome, and we have one on our website, very easy to use and take. And you can just, again, go to the DS Works portion of the website and do it online. And it's for self-advocates who are 18 and older who have Down syndrome. And it's for individuals with Down syndrome, all individuals with Down syndrome ages 18 and over, and not just individuals with jobs, because we're trying to get an understanding of what the employment landscape looks like. We're also asking for success stories. We know there's a lot of success stories out there that we don't know about. We want to know about those stories, and we want to share those with others because they're encouraging to others. So we have a spot, again, on our website where you can submit those. We want materials, again, a place that you might be able to help us is we're looking for employment initiatives from around the country. Those do not have to be DS specific. We have some Down syndrome affiliate groups who have programs, but we know there are some other really good local employment programs out there, and we would like to know about those so maybe we can learn from those or connect them to other people so that they can share information. We also want to develop, we are looking for information on resources for individuals with Down syndrome who are looking for jobs. If there are materials or workshops that you're familiar with that might help in job interview skills or job preparation, even sample resumes, we would love to know about that. Resources for families, again, who are in the early stage, transition resources, examples of language for job-related goals, anything like that that you might know about, we would love for you to share with us. I'm going to talk about the advocacy alerts on another slide, so let's go to another slide. The next slide, please. The next slide talks about our legislative agenda. Able to Work has been introduced in the House and the Senate. And you all can read this for yourselves, but it basically is an ABLE Act enhancement bill that will allow individuals with Down syndrome, individuals with disabilities, individuals who have ABLE accounts, and their families to save more money in the ABLE account if the beneficiary works and earns income. The beneficiary is the owner of the account and is the person with the disability. So this bill would allow an individual who has an ABLE account to earn income up to the federal poverty level beyond the existing $14,000 cap. We feel very strongly that this will help people with disabilities to transition out of poverty, because we all know that individuals with disabilities often live in poverty and sometimes live in poverty not by choice, but because to be able to keep their supports, they almost have to live in poverty. So it is one of the bills that we are pushing and would love for you all to help us get more sponsors for. Transition to Independence Act is introduced in the Senate, and it would create a 5-year Medicaid demonstration program in states to give bonuses to states who are helping individuals with disabilities obtain integrated employment for reducing sub-minimum wage work. And we know that we do not want individuals with disabilities working in jobs where they're not earning at least a minimum wage. Transition to integrated meaningful employment, also Senate and House, phases out over 3 years the Fair Labor Standards Act, which authorizes the Secretary of Labor to issue special wage certificates to certain entities, which, I hope I'm stating this right, I believe has helped some organizations be able to pay individuals with disabilities sub-minimum wage. We will also be working with states to try to get rid of sub-minimum wage and transition out of sheltered workshops. Another initiative that we are going to be supporting is financial literacy, because more individuals with Down syndrome and other disabilities are going to have money in able accounts, so we're going to need to be, they're going to have more financial literacy to manage those. Next slide, please. This is just a summary. If you're interested in helping to find sponsors, co-sponsors for the Able to Work Act, this is the summary of the legislation that I just talked about. And I'm not going to read that to you all. For time's sake, I'm not going to read that to you all. But basically, it would allow an able beneficiary who is working in a job to contribute up to $25,770 per year to that account to be able to save money to be able to help them live independently. The contacts, the co-sponsors and the contacts are over to your right on that slide. Next slide, please. Again, I'm not going to go through the background on this because I think that you all can read that, and I'm sure that you will be probably getting a copy of these slides. And you can also contact us, and our contact information is on the final slide. We just believe, as I'm sure you all do, that working is one of the ways that individuals with Down syndrome are able to live healthier and more productive lives. And so it's important to us that we put into place legislation and other supports that will allow individuals with Down syndrome to work. Next slide, please. Again, more talking points, and I'm not going to go through those because I know you have a packed schedule today. Next slide, please. Ndss advocacy alerts. We do have advocacy alerts that you can find on our website. That's actually the little Capitol building or dome is actually what you click on to sign up. So if you're interested in signing up for our advocacy alerts, or you know others that should, please go to our website and do that. You can contact either Heather Sachs, who is our Vice President for Advocacy and Public Policy, or myself. Our contact information is there on the slide if you have questions or if we can provide more information. So again, I want to thank you all for allowing us to be on the call today.
Thank you, Jawanda. Would you like to take any questions now, or were you planning, or are you?
Do you have time, or do you need to move on?
No, we can definitely open up the lines for some questions.
Okay. I hope I can answer them.
Yeah, I just wanted to go out.
Okay, great. The lines are open. If anyone has any questions, feel free to ask.
Colors of wedding seems to be like pale pink, almost like a blush color with some gold champagne. So
I didn't quite understand the question.
I think that was someone who's in a public place currently, so some of the additional noise was coming through. If anyone has any additional questions, you can feel free to contact Jawanda or Heather at addresses that are shown here. And thank you, Jawanda.
Thank you so much.
Of course. And my colleague Stephanie Fisher just reminded me to note that our the legislative conference registration to June 24th. So we definitely urge you to visit rareadvocates.org and get registered today. So next we will have Patricia Egan with the National Lymphedema Network, who will give a presentation on the Lymphedema Treatment Act. Patricia, are you there?
Yes, I am. Can you hear me, Vignesh?
Yes.
Okay, thank you. So before I start on the Lymphedema Treatment Act, I would just like to say that the National Lymphedema Network is already a supporter of the newborn screening legislation in California. We feel that it's extremely important. and well in keeping with our organization's mission and goals. The other thing I would like to say right now is that last year, National Lymphedema Network did participate in your West Coast Legislative Advocacy Training Conference at UCSF Medical Center. It was beautifully organized. The materials were excellent. The networking and connection building could not have been better. And I would encourage anyone who's near Seattle, Chicago, or Boston to go ahead and sign up. It's time well worth spending. All right, so enough of that. But let me, so the Lymphedema Treatment Act has been introduced in both the House and the Senate. It provides very much needed Medicare benefits to cover compression materials that lymphedema patients and anyone with a lymphatic disorder there has to have every day. Lymphedema is classified as a group of rare diseases, and if anyone would like to know more about that, there's a well-written description at the NORD website. Next slide, please. So the act was introduced in the 114th Congress by Representative David Reichert in the House and by Senator Maria Cantwell in the Senate. This legislation was introduced because we went to two Secretaries of Health and Human Services, both Secretary Burwell and her predecessor, and they essentially told us that if we wanted to have a benefit category in the Medicare statute, we needed to take it to Congress. Next slide, please. As of today, we have 233 co-sponsors in the House, and Representative Reichert delivered testimony about the bill at the House Ways and Means Health Subcommittee hearing on June 8th, which is a significant step forward towards getting this bill to a vote. In the Senate, because it was only introduced in December, we have 19 co-sponsors, and we are aggressively working with our state teams to secure more co-sponsors in the Senate. Next slide, please. So we just thank the RDLA so much for supporting the Lymphedema Treatment Act. All of this legislation for rare disease patients, this is for things that we very much need. We have to have them to contain our diseases, to have our self-care management, and to preclude our diseases taking a step in a worse direction. So it's very important. For more information, please see the lymphedema-treatment-act.org website. Are there any questions?
She was, oh gosh, it was the year December 29th. Yeah, and I saw her for this time, and then I saw her, we were visiting here in June 3rd.
Your agenda.
Question?
This is Pat. I thank you for giving me the opportunity to keep people up to date with the Lymphedema Treatment Act. And lymphedema. I just want to get myself
forward with your agenda.
Great. Thank you very much, Pat, and we look forward to hearing more from you in the future.
Thank you.
So next, I will just give an update on our newborn screening initiative in California, SB 1095. My name is Vignesh Ganapathy. I'm the policy manager here at the Every Life Foundation for Rare Diseases. For those of you who haven't been on our last couple of calls, we've been working on a newborn screening initiative to address the disparity in newborn screening panels across the country. There's a patchwork of screening between states with dramatically different requirements. While some states screen for just over 20 diseases, others screen for over 50. So many babies are falling through the gaps, and that causes delays in treatment and diagnosis that can have terrible health outcomes. We launched this legislation in California to automatically require the state to screen for all diseases that are included on the RUSP, which is a federally recommended panel of diseases, which I will describe a little going forward. So newborn screening is incredibly important. It saves lives and it saves money. Early detection and treatment can help avert many costly medical procedures. These include hospitalizations, surgeries, and the search for a diagnosis. For example, a spinal fusion surgery can cost around $100,000. In the U.S., states also spend millions of dollars to provide mental health services to children, and by not treating at the earliest signs of symptoms, in addition to surgeries and hospitalizations, there may be developmental issues that arise as well. So, you know, it can be a significant cost to the state. In California, for every dollar that's spent on newborn screening, the state saves upwards of $9.32. So considering the disparities that many states have regarding newborn screening, the Secretary of Health and Human Services convenes an advisory committee on heritable disorders in newborns and children. This committee issues what's known as the Recommended Uniform Screening Panel. It's as noted with the word recommended, it's a suggestion of diseases that states should screen for. And the way that a disease gets added to this panel is that it's nominated often by a patient advocacy organization or another healthcare-focused group. It's considered by the committee, and the committee recommends whether it should be added to the Secretary of Health and Human Services. And the Secretary of Health and Human Services then decides whether it's accepted, and at that point, the disease is added to the RUSP. It can take almost 4 years to add a disease to the RUSP, and states can take up to 8 years after those 4 years to actually begin screening. So even though this panel seeks to standardize the newborn screening panel, it can still take a great deal of time for states to adopt the standards. So the panel includes over 55 diseases. The most recent additions were MPS I and ALD, as well as Pompe, and potential diseases that are being considered include Duchenne muscular dystrophy, MLD, other MPS diseases such as MPS IV and MPS VI, Batten's disease, and creatine deficiency disorders. You can find the full list at the advisory committee's website that's shown below. So why California? California screens for 540,000 newborns each year, and they screen for most of the diseases on the RUSP except for two, Pompe and MPS I. Since the Every Life Foundation is based here in California, it made sense to first work here to try and push this legislation, and we want to use it as a blueprint and a model for other states going forward. Both MPS I and Pompe have had an FDA-approved therapy for over a decade. The state has 5 public health laboratories that currently use a tandem mass spectrometry of dried blood spots, basically the heel prick, to determine what diseases a child may have. And California most recently in 2014 passed a bill screening for ALD as soon as it would be added to the RUSP. So now that it's been added, the state has begun implementation. So SB 1095 was introduced by State Senator Richard Pan, who is a pediatrician. He authored the life-saving ALD and SCID newborn screening bills in the past few years and has been a real leader in this area. SB 1095 would allow the state to screen for a disease as soon as it's added to the RUSP. This would eliminate that legislative delay of nearly 8 years and ensure that babies are screened for diseases at the earliest possible point. It takes a scientific approach instead of a political approach, so advocates do not have to come to the legislature every year to have their disease screened for on a panel and have to do this in all 50 states. Rather, they can focus their efforts on the advisory committee, which considers this in a scientific context. It's staffed with experts and doctors that are quite prevalent in the field. And it would allow for the earliest treatment possible, saving many patients' lives. So when it comes to the process for SB 1095, the bill must pass 2 committees in each house. That's the health committees and the appropriations committees, and each house's floor before it gets sent to the governor. The appropriations committees have been and continue to be the difficult point in California. The state's very concerned with budgets, so we have been working to use economic data to show that screening for MPS 1 and Pompe will save the state money. This is through demonstrating that the search for diagnosis will not take as nearly a long a time, that surgeries in a hospital stays, costly ones, could be avoided, and mental health and other developmental care and tangential costs could be avoided as well. So we have some good news. On June 2nd, the bill passed the Senate floor, and yesterday, SB 1095 passed the Assembly Health Committee unanimously. We had advocates from across California come and testify. The image up top is of the advocates with Dr. Pan celebrating the victory. The image on the right is from earlier this year when the bill was considered by the Senate Health Committee, and we had 4 advocates from across the country testify in support of newborn screening. So we have some important upcoming dates. July the 1st was the last day for SB 1095 to be heard in the Assembly Health Committee. Since that's already passed, we're moving into the Assembly Appropriations Committee. There's a summer recess that takes place for the month of July, and August 12th is the deadline for the bill to be heard in the Assembly Appropriations Committee. And then by the end of August, there's the last day for an Assembly floor vote. So after the bill is passed by both houses, it goes to the governor, and the governor has 30 days until September 30th to sign or veto the bill. In California, if the governor doesn't sign or veto the bill, it automatically becomes law. And here's how you can help support newborn screening. Definitely, if you have case studies of the benefits of late versus early treatment, sibling studies, feel free to forward them on to us. And please join the sign-on letter. We currently have over 110 endorsing national patient organizations. Thanks to all of you who have signed on. And this includes March of Dimes, NORD, the Muscular Dystrophy Association, and Global Genes. And if you have already signed on, feel free to share this link with your networks. It's important to try and have as many numbers as we can on this letter. And if you're an organization that's based in California, feel free to write letters to your state senators and assembly members urging them not only to support the legislation, but to co-author the legislation. We want to make sure that we have as wide support as possible. The bill's passed unanimously through every committee so far, as well as the Senate floor, and we'd like to keep that going. And of course, you can come to Sacramento and support SB 1095 in person. This is a great way to help move the bill forward. Legislators love hearing from parents and patient advocates, and your story can definitely help get this bill passed. So finally, I'm going to open it up to questions. If any of you have any questions about the newborn screening initiative,
a reasonably priced physician. I'm still going to do all of. I'm a physician.
Anyone have
reasonably priced photographer, CJ, and
I have a question. This is Joyce Stobbert from San Diego with the Cancer Awareness Foundation. How are you?
I'm doing well.
I'd like to know. Good. I'd like to know if SB 1095 is that sign-on letter is on the website, is on the RDLA website.
It is. I'll move the slide back real quick. It's at the Every Life Foundation website.
Every Life. Okay.
And
I will go there and sign this up.
Absolutely. Feel free to. And if you have any questions, you can email me, and I can forward any other information along to you as well.
Very good. Thank you.
This is Pat Egan from the National Lymphedema Network.
Hi, how are you?
So I have one question for the letter, the online letter. I understand that you're seeking endorsement from various organizations, but for individuals, just your average citizen voter, is that letter also an appropriate place for them to sign on, or do you have another place where you prefer that individuals?
We have a sign-on letter for individuals, but the best way to get involved as an individual is we will have actions coming up, especially focused on, California Assembly members and senators that as the bill moves forward. If you are based in California, we also strongly urge you to contact your senator or assembly member. You can do that through a letter, which we have a site for that as well, or you can look them up and feel free to just give them a call and show your support for the bill.
Thank you.
Anyone else have a question? Great, thank you. I'm going to move this over to Harry Sporidis, who is going to give the update on the goings-on around Capitol Hill and the 24 Years Act. Harry, are you there?
I'm here. Thank you so much. And, let me just say thank you for everybody that's on the line. We really appreciate everybody's help, obviously. And I'm really happy to be pinch hitting for Max today. So the picture that you see on the screen of the handsome person, that is not me. If we can go to the next slide. So we're pushing for the 21st century cures. As many of you know, the House Energy and Commerce Committee and the House of Representatives was able to move a very big piece of legislation through the Congress, H.R. 6. This was shepherded through by Chairman Upton, who is to the left of young Max in the middle of that picture, and Diana DeGette from Colorado, who's to the right. It was a bipartisan effort, and it was approved in the House Energy and Commerce Committee unanimously and overwhelmingly approved by the House of Representatives on July 2015 by a vote of 344 to 77. Let's go to the next slide. The Senate Help Committee and the Senate has taken and approached this legislation in a little bit of a different tact than the House. The House decided to tackle this all as one big piece of legislation where Senator Lamar Alexander of the Senate Help Committee, the chair of the Senate Help Committee, did this in pieces. So we have several different pieces that have been approved by the Senate Help Committee, but they have not yet been engrossed into one bill. And the way they did this is they did 3 separate markups and approved bills that everybody unanimously agreed to, but unfortunately those bills have not been engrossed into one bill and moved on the Senate floor yet. And this is somewhat troubling at this point, but it looks like things might be shaking loose. So let's go to the next slide. So there are a number of rare disease provisions that were included in the bill and in the bills, I should say. Obviously, in the House bill, there was a number of different rare disease provisions, but in the Senate bill, we had the advanced targeted therapies for Rare Diseases Act of 2015, Advanced Neurological Disease Act, Advanced Hope Act, legislation supporting precision medicine initiatives, patient-focused impact assessments, which PFIA, as many of you might know, and workforce enhancement at NIH and FDA. We can go to the next slide. Unfortunately, missing in the Senate bill, there was no agreement on NIH FDA funding, and unfortunately, the OPEN Act, the Orphan Product Extension Now Accelerating Cures and Treatments Act, which was one of the crown jewels on the House side, was not acted upon or voted on, I should say, in the Senate Help Committee. The bill was offered and withdrawn by Senator Hatch in order to set a marker down and to allow the chairman of the Help Committee, Chairman Alexander, basically to have him understand that this is a very important bill that senators want to see as part of the overall bill, and to include this bill as part of the chairman's mark when it comes to the Senate floor. That would be the manager's amendment. So when these bills come down to the Senate floor, the chairman can add things, and then the entire body votes on them as necessary. So that is what Chairman Hatch was doing. Chairman Hatch is the chairman of the Finance Committee, and is the person that will be funding this entire bill. That is what he was doing and telling basically Chairman Alexander to do. So let's go on to the next slide, Dinesh. So NIH and FDA funding, deal or no deal. This has been the sticking point on the Senate side. Matter of fact, an article was just published today that many in the Senate are blaming Senator Warren of Massachusetts as being the main sticking point of this bill not being approved yet on the Senate floor. So there has been a sticking point on the Senate side to increase funding for NIH spending and FDA spending, but NIH spending mainly. Although many in the Senate have tried to placate Senator Warren, she is not. She's not making the deal that she should be making, unfortunately. So the Senate is looking at other ways and other avenues in order to move this bill. So if we can go on to the next slide. So basically keeping the momentum up, we are hearing right now that the Senate is working hard to include cures as part of the CARA Act. CARA is the bill that was approved by the House, approved by the Senate, which is focusing on the opioid epidemic that has been taking place all over the country. What the Senate is trying to do right now, and what I believe Chairman Alexander and Chairman Upton on the House side, they have pleaded with party leaders on both the majority and minority side to include cures as part of the conference report on the opioid legislation. What will happen there still remains to be seen, but we are hearing that there might be some maneuvering to shake this thing loose and get it out from under some of the Senate Democrat opposition to moving this bill, because the NIH funding is not high enough for those senators. Go to the next slide. So, as you know, I think I jumped ahead here, but you know, rumors of the larger package being assembled. I just told you about that. One of the things that we need and that is really important is for the advocacy community to really come out and call your members on the Senate side, letting them know that it is very important to get this bill done and get it off the Senate floor and into conference so we can get this process moving. This bill allows us to basically unleash the FDA and take some of the chains off the FDA to bring curative therapies onto the market, you know, out there and into the marketplace that are so desperately needed. So we, you know, if calls can be made to your U.S. senators, letting them know that, you know, getting this bill done is imperative, that would be really appreciated. Go to the next slide. So now I'm going to leave the questions. You all can keep Max's email address. if you want to email Max questions. But I'm happy to take any questions right now if you have any.
Everyone, I have. Feel free to ask.
Anybody? Yeah, I'm happy to answer any questions. Perhaps I put everybody to sleep. I apologize.
We have.
Somebody asking a question because I can't hear anything right now.
Sorry about that. Looks like someone had is making a little bit of noise there. I was Patricia Egan asked how many co-sponsors in the Senate we have.
Well, we have several. So obviously it's a Hatch-Klobuchar bill. So it is a. You mean in terms of open or in terms of? Are we talking about open?
Yes.
In terms of the Open Act, it's Hatch-Klobuchar. It's a bipartisan bill. Senator Tim Scott of South Carolina has signed on to the bill. Senator Kirk of Illinois has signed on to the bill. Senator Menendez of New Jersey has signed on to the bill. And we just got Senator Cory Booker onto the bill just recently. So we have a good bipartisan group of senators that are on this bill.
And then second question, given the timing and that this is a presidential election year, how likely is it to get action in the Senate by the end of the 114th Congress?
Well, that's what we're hoping to see. And I do think that there is a likelihood. What we're hoping to see is that this bill gets shaken loose before this July 4th recess. And that's coming up here rather quickly. And I think that is what we're seeing right now in terms of Chairman Alexander and Chairman Upton going to party leaders, pleading with party leaders to find a mechanism in which to get this bill off the Senate floor. And that's what they're doing right now. So I think there is a chance we're going to see some sort of legislation done prior to the July 4th recess. If it's not done prior to the July 4th recess, the likelihood of us seeing this bill getting done will most probably be during the lame duck session of the Congress. And that would mean after the November elections, after the presidential elections take place.
Great. Thank you, Harry. Does anyone else have any questions? All right. If anyone has any questions, you can feel free to email Max at this address. And then you can, of course, you can email me if you have any questions about any of the presentations today. I want to thank everyone for taking part, but I also would like to make a plug for the Rare Voice Awards, which the Foundation is hosting on later this year. The nominations are open until July 31st, 2016, and it's an opportunity to recognize leaders in the rare space. So these include patient advocates, patient organizations, congressional staffers, government agency staff, and other great voices for the community. So visit rarevoiceawards.org and please get your nominations in today. And finally, I'd like to note that since the congressional recess is upcoming, our next webinar and conference call will be in September, on September 14th at 1 p.m. We would like to urge all of you during this time, please consider registering for the in-district lobby days and legislative conferences. It's a good opportunity to get involved with your legislators during that recess. You can, of course, visit rareadvocates.org to get registered for that. If you have any questions, feel free to email me at vganapathy@everylifefoundation.org. I'd like to thank all of you for joining today and look forward to hearing from you soon.